Hello and welcome to this special broadcast. This is Dr. Shamin Eabenson coming to you live from Eabenson Television. So today we are going to talk about a medical topic, and the topic is diabetes mellitus. So diabetes mellitus is one of the major non-communicable disease that is existing in the world today. So it is a metabolic disease. So what is a metabolic disease? So basically, in this disease, it is not communicable. That is, it does not spread from one person to another. So, what are the signs and symptoms of this disease? So, first of all, symptom is anything that a patient complains to a doctor. So, it will be in layman terms. And a sign is something that a doctor elicits. So, in this case, the patient will come with their complaints. That is, the symptoms like increased thirst, then increased frequency of urination, and there'll be increased hunger. The same things a doctor will tell in technical terms, and that is called signs. The signs they elicit are that is polyuria, polydipsia, and polyphagia. So these were the clinical signs and symptoms. Then we are going to talk about the pathophysiology, or why is this happening. So in the body there is an organ called pancreas. The pancreas, inside that there are so many cells called islets of Langerhans. In these there are beta cells. So these are destroyed. So there are two types. Either it could be due to the absolute absence of beta cells of islets of Langerhans, or it could be a loss of function, or a combination of both. So in this, what happens? So there are so this is the main pathophysiology. So basically whatever we eat, or that is ultimately digested and is converted into form of glucose. So this glucose is transported through the blood to different organs. So this glucose, when it becomes excess, that leads to some problems. So in the body there are some hormones, that is regulatory and counter regulatory hormones, and based on the action of these hormones, what happens is these the blood sugar is aptly or adequately maintained in the body. But whenever there is a dysregulation of these things, we get diabetes mellitus. So the body, there are some processes like glycolysis, then gluconeogenesis, and all these things, and where they distribute the glucose to different other body parts, and therefore this homeostasis is maintained. So we talked about what it is, the definition, then we told about the signs and symptoms, then we told about the pathophysiology. Now we are going to learn about the normal values. So blood sugar, it is measured in the morning, that is fasting without maybe not taking any food for 8 to 10 hours. Then when we measure the fasting blood glucose, the normal value, it is, if it's less than one, that is the normal glucose value can be around 75 to maybe 110, or we can tell it's up to 126. So basically, it's 75 to 100 to 110 is perfect normal value. So 110 to 126, we say there is maybe deranged what do you call it, glucose levels, and more than 126, we say that fasting blood glucose. We say that it is diabetes. Then we talk about the other thing, that is postprandial blood sugar. If it's more than 200, definitely we can say that it's diabetes. Then less than 140 is kind of ideal. Then when we talk about the random blood glucose, it is, if it's more than 200, it is diabetes. So, and also the other criteria is there is something called HbA1c. HbA1c is glycosylated hemoglobin. That it shows the level of hemoglobin for in the control of the glucose in the past 3 months. So if it is more than 6.5, then we say that the person has diabetes. So regarding the HbA1c value, if it is less than 5.7, we say it is normal. If it's between 5.7 to 6.4, we say there is a derangement or impaired glucose. And if it's more than 6.5, we say that it is diabetes. In the same way, fasting blood glucose, I told you, if it's 75 to 110, it is perfectly normal. 110 to 125 or 126, you can say it's impaired, and more than 126, it is diabetes. In the same way about postprandial blood sugar. So we talked about those values also. Then the main problem with diabetes is that it can cause a lot of complications. Complications means that there are something which are undesirable. There are long-term complications. So we can say that there are microvascular complications and macrovascular complications. So when a person has diabetes for a long time, what happens is that it can actually affect the eyes, it can affect the kidneys, and also affect the nervous system. So when it affects the eye, we call it is diabetic retinopathy. When it affects the kidney, we say it's diabetic nephropathy. And when it affects the nerves or the nervous system, we call it as diabetic neuropathy. So based on this, so the whole aim is to prevent the onset of these complications or to delay the complications. So for this, what is needed? First of all, we need to regulate our diet. We need to regulate our diet. We need to regulate our the way we take our food. That is, diet plan should be followed as advised by the nutritionist. Then we there are several systems. So that is a diabetic diet, and how we divide. That is, we take instead of taking a large quantity of food, we actually regulate it. We split it up, and also we ensure that carbohydrates are kept to a minimum. Then we increase proteins and other things. Now, when we come to medicines, there are several classifications of diabetic medicines. So, for example, we can say that diabetic medicines like there are some classification like biguanides, in that there is metformin. So it's available in 500 milligram and 1 gram. This can be taken once a day, twice a day, or 3 times a day as advised by the physician. Then after that, there are sulfonylureas like glimepiride, glipizide, or there are four kinds of drugs. And these can be given in 1 milligram, 2 milligram, 3 and 4 milligram, and this can be taken as advised by the doctor. Some of the this can cause hypoglycemia or sudden decrease in blood glucose level, and this can also cause some problems. So that is one of the disadvantages of this class of drugs. But the other good thing about biguanides or metformin is that it does not cause hypoglycemic attacks. But the other thing that it can cause some gastritis and other things. And it is also found that obesity is actually controlled with the use of these biguanides. Then we also see that there are other classes like ripaglinide, nataglinide, and other things. Then we see that there are classes like voglibose, which is given in zero point 0.2 milligram, and zero point 0.3 milligram can be taken 3 times a day. And this is usually useful when there is a lack of postprandial blood glucose control. But only the side effects is that it can cause flatulence. So these are some of the drugs. Then there are some newer drugs that then also there are some things like insulin, like human mixture, then human insulin. Then there are other short acting and intermediate acting. All kinds of insulin are available. So based on all these things, we have to ensure that the blood sugar is kept at an optimum so that complications can be prevented or it can be delayed. Now, coming to the classification, diabetes mellitus, it can be classified based on the etiology. So basically, generally, it was classified as type 1 diabetes mellitus and type 2 diabetes mellitus. Then there are other types of nutritional diabetes, then so many other categories. So what is type 1 diabetes mellitus? So type 1 diabetes mellitus is a condition that is seen in younger age group. So maybe less than 30 years of age. And in these people, what happens is they are prone to get diabetes at a very early age, and they may be slim people, slender people, and they might not have any other problem. But in this case, there is an absolute lack of insulin in the body, and insulin has to be supplemented. That is, they have to take insulin. That's the first thing. Then the second thing is that there is type 2 diabetes mellitus. This is very much common in middle-aged people, maybe 40 to 50 years old, and elderly people. So here the problem is there is increased resistance of the body to how these diabetes is regulated. So what happens here? So in these cases, people, they will have truncal obesity. That is one of the features that is seen here. And these people, they are susceptible to maybe this is maybe so many other things can happen, like delayed wound healing. Then all the other signs and symptoms which I told earlier, those things can be seen. So type 2 diabetes is more common in elderly, maybe 40 to 50 years and above. Then carefully we have to maintain the blood glucose level. So generally, I told you about what is diabetes, then what is the incidence or the prevalence of diabetes. Then it is a global disease, much more common in India. That is 1 in 5 Indians are maybe diabetic. Then I told you about the pathophysiology, the clinical classification. I told you about the normal values, the drugs that I use, the complications. So this is diabetes in general. and as a patient you have to early detection of diabetes is needed so that the complications can be prevented and adequate treatment can be given. So this is diabetes in nutshell. And thank you for listening to this broadcast. I will come back again and we'll be keep on discussing some other newer modalities of treatment and other things. And stay tuned. This is Dr. Shaman Eabenson signing out. Thank you.